Medical Assistant Exam Room Preparation Questions. Question 1. As part of exam preparation in an urgent care office, the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A, 10 mm per millivolt. Option B, 25 mm per millivolt. Option C, 100 mm per millivolt. Option D, 1 mm per millivolt. The correct answer is option A, 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That value is not the common standard amplitude calibration. That value would greatly exaggerate waveform size. That calibration would make complexes appear too small for standard interpretation. Question 2. Given the workflow in a medical office workflow, a rapid strep test requires a throat swab. Which technique is best? Option A, touch the tongue repeatedly to collect saliva. Option B, collect sputum from a deep cough. Option C, swab the tonsillar area and posterior pharynx while avoiding the tongue. Option D, swab the outside of the lips. The correct answer is option C, swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. Saliva and tongue contact can dilute or contaminate the specimen. Sputum is not the specimen used for a rapid strep throat swab. The lips do not provide the specimen needed for strep testing. Question 3. During a same-day appointment, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A, verify the allergy information and enter it clearly in the medical record. Option B, place the form in the chart without reviewing it. Option C, ask the patient to remember only prescription allergies. Option D, remove allergies that the patient says happened many years ago. The correct answer is option A, verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Important safety information can be missed if the history is not reviewed. Allergies to over-the-counter drugs, foods, or latex may also affect care. Past reactions may still be clinically important and should not be deleted without provider direction. Question 4. At the start of care in a busy front office, the provider is running behind and a patient asks for an update. Which response is professional? Option A, tell the patient that waiting is their only option. Option B, guarantee an exact time even when it is unknown. Option C, discuss another patient's emergency as the reason. Option D, apologize for the delay and provide the best available estimate. The correct answer is option D, apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Dismissive communication is unprofessional. False certainty can create more frustration. Sharing another patient's situation can violate privacy. Question 5. During a family practice clinic, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A, below normal. Option B, between. Option C, above normal or excessive. Option D, around. The correct answer is option C, above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Below normal is indicated by hypo. Between is indicated by inter. Around is indicated by peri. Question 6. For a patient encounter in a community health clinic, a patient wants information released to a spouse. Which documentation is usually needed? Option A, no documentation because spouses always have full access. Option B, a note written by the assistant after the fact. Option C, a valid authorization or permission according to office policy. Option D, a verbal request from the spouse only. The correct answer is option C, a valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Relationship alone does not automatically grant full access to records. Authorization should come from the patient or legal authority. The spouse's request alone may not authorize release. Question 7. When a patient encounter unfolds in a medical office workflow, a mask becomes wet during patient care. Which action is appropriate? Option A, keep wearing it for the rest of the week. Option B, share it with a coworker. Option C. Replace the mask according to infection control practice. Option D. Dry it on the clean supply shelf. The correct answer is option C. Replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Extended use of a wet mask is not appropriate. Masks are not shared between staff. Used masks can contaminate clean areas. Question 8. During a certification exam scenario, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Sit upright and lean slightly forward. Option B. Tilt the head far backward. Option C. Pack the nose with contaminated gauze. Option D. Lie flat immediately without assessment. The correct answer is option A. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood, while upright posture can reduce pressure. Tilting backward can cause blood to drain into the throat. Contaminated materials should not be inserted into the nose. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 9. An office review in a preventive care visit shows that a sterile dressing change is being prepared. Which action helps maintain sterility? Option A. Reuse sterile gloves from a previous patient. Option B. Place sterile gauze on an unclean counter. Option C. Reach across the field with unsterile clothing. Option D. Open sterile supplies without touching the inner sterile surface. The correct answer is option D. Open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Sterile gloves are single-use and patient-specific. An unclean surface contaminates sterile supplies. Reaching over the field can contaminate it. Question 10. When a patient encounter unfolds in a community health clinic, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Ask a coworker to change it under their login. Option B. Ignore the error even if it affects care. Option C. Delete the original note completely. Option D. Make an addendum according to office policy. The correct answer is option D. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Using another person's login violates accountability. Clinically important errors should be corrected through proper procedures. Deleting a signed record can destroy the audit trail. Question 11. When a patient encounter unfolds in an urgent care office, a chain of custody urine drug screen is collected. Which practice is most important? Option A. Use an unlabeled container until the lab receives it. Option B. Allow the patient to take the specimen home first. Option C. Skip signatures if the specimen looks normal. Option D. Document each transfer and maintain specimen integrity. The correct answer is option D. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Unlabeled specimens can be rejected and cannot be reliably traced. Uncontrolled possession breaks specimen integrity. Appearance does not replace custody documentation. Question 12. While working in a busy front office, a specimen label is missing after collection. Which action is best? Option A. Ask another patient if the tube belongs to them. Option B. Write a name on the tube from memory. Option C. Send the tube with no label and explain later. Option D. Follow facility policy for recollection or correction without guessing. The correct answer is option D. Follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Patients cannot resolve specimen identity errors reliably. Guessing can cause a serious misidentification error. Laboratories commonly reject unlabeled specimens. Question 13. For a patient encounter in a family practice clinic, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A. Gray fluoride tube for all serum tests. Option B. Light blue citrate tube for serum. Option C. Lavender EDTA tube for serum. Option D. A red or gold serum tube. The correct answer is option D. Red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. Gray tubes are not the standard serum tube for routine chemistry panels. Citrate anticoagulant is used for coagulation testing. EDTA prevents clotting and produces whole blood or plasma, not serum. Question 14. Following office protocol in a procedure setup, a claim requires the code for an office visit procedure or service. Which code set is used? Option A, policy number. Option B, zip code. Option C, ICD-10-CM. Option D, CPT. The correct answer is option D, CPT. CPT codes describe medical procedures and professional services. A policy number identifies insurance coverage and does not describe the service. A zip code identifies location and is not a procedure code. ICD-10-CM codes describe diagnoses and reasons for services. Question 15. Given the workflow in a patient education session, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A, share the chart because staff work in the same clinic. Option B, open the chart if the coworker promises not to tell anyone. Option C, print the chart and remove the patient's name only. Option D, deny the request because there is no job-related need to know. The correct answer is option D, deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. Employment at the same clinic does not automatically authorize chart access. A promise does not create a permitted reason for access. De-identified information must meet specific standards and curiosity is not permitted access. Question 16. While working in a patient intake station, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A, refuse to document relevant information. Option B, assume all people from that culture act the same. Option C, ask respectful questions and avoid judgment. Option D, tell the patient the practice is foolish. The correct answer is option C, ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Relevant patient information should be documented according to policy. Stereotyping ignores individual differences. Judgmental language damages trust and may prevent disclosure. Question 17. During a pediatric clinic, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, Fowler position. Option B, lithotomy position. Option C, prone position. Option D, Trendelenburg is the only routine choice. The correct answer is option A, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Lithotomy is used for pelvic procedures and does not primarily support breathing. Prone places the patient face down and may worsen breathing comfort. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Question 18. As part of exam preparation in a cardiology practice, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, the assistant's diagnosis before the visit. Option B, demographics, contact information, insurance information, and reason for visit. Option C, another patient's insurance card. Option D, only the patient's favorite pharmacy color. The correct answer is option B, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. The assistant should not diagnose during scheduling. Insurance information must belong to the patient being registered. That information does not complete registration. Question 19. Before the visit continues in a diagnostic testing area, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A, measure blood pressure and pulse in different positions according to protocol. Option B, record the first seated blood pressure as orthostatic. Option C, measure only oxygen saturation while the patient is seated. Option D, have the patient walk quickly before the measurement. The correct answer is option A, measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. A single seated reading does not show positional change. Oxygen saturation does not assess the blood pressure and pulse changes requested. Exertion can distort the readings and increase fall risk. Question 20. Given the workflow in an exam room, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, leave the container unrefrigerated unless it smells unusual. Option B, keep only the first void and discard the rest. Option C, discard the first void and collect all urine for the next 24 hours. Option D, collect urine only when symptoms occur. The correct answer is option C. Discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. Storage requirements should follow the test protocol and preservative instructions. A single first void is not a 24-hour collection. Timed urine testing requires all urine during the collection period. Question 21. While working in an outpatient laboratory, a waved glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A, resolve the quality control problem according to protocol. Option B, change the patient's diagnosis to match the meter. Option C, record patient results without documenting controls. Option D, use the meter because patient samples are different. The correct answer is option A. Resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Medical assistants do not diagnose and should not alter clinical information to fit a device. Quality control documentation is part of reliable testing. Failed controls must be addressed before reporting patient values. Question 22. A medical assistant is working in a women's health clinic when an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, send the patient home to rest without notifying anyone. Option B, erase the value because it may worry the patient. Option C, recheck using proper technique and report the finding according to protocol. Option D, tell the patient that hypertension has been diagnosed. The correct answer is option C. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Abnormal readings require appropriate follow-up rather than dismissal. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Question 23. In a medical office workflow, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A, perform blind finger sweeps immediately. Option B, leave the patient alone until they stop coughing. Option C, give the patient food to push it down. Option D, encourage coughing and monitor closely. The correct answer is option D. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Blind finger sweeps can push the object deeper and are not appropriate. The patient should be monitored because the obstruction may worsen. Food can worsen the obstruction. Question 24. For a patient encounter in a same-day appointment, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A, spirometer. Option B, ophthalmoscope. Option C, otoscope. Option D, speculum for pelvic exam. The correct answer is option C, otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A spirometer evaluates lung function rather than the ear. An ophthalmoscope is used to examine internal eye structures. A vaginal speculum is not used to inspect the ear canal. Question 25. In a preventive care visit, the term nephrology appears in a referral. Which specialty is involved? Option A, bones. Option B, kidneys. Option C, eyes. Option D, ears. The correct answer is option B, kidneys. Nephrology is the specialty focused on kidney function and disease. Orthopedics focuses on the musculoskeletal system. Ophthalmology focuses on eyes. Otolaryngology focuses on ear, nose, and throat conditions. Question 26. For a patient encounter in a quality control review, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A, place a warning sign and arrange cleanup immediately. Option B, ignore it because it is not in an exam room. Option C, cover it with loose papers. Option D, wait until a patient reports slipping. The correct answer is option A. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Safety hazards matter throughout the facility. Loose paper can worsen slipping and does not clean the hazard. Prevention should occur before an injury happens. Question 27. Given the workflow in a patient education session, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The machine draws blood through the wires. Option B. The electrodes inject medication. Option C. The test records electrical activity and does not deliver a shock. Option D. The test shocks every patient to start the heart. The correct answer is option C. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrocardiogram leads do not collect blood. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Question 28. Given the workflow in a clinical skills review, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Give a diagnosis over the phone. Option B. Follow emergency triage protocol immediately. Option C. Tell the patient to send an email later. Option D. Schedule the patient for next month. The correct answer is option B. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Medical assistants should not diagnose the cause of symptoms. Potential emergencies require immediate action. Routine scheduling can delay care for potentially serious symptoms. Question 29. When a patient encounter unfolds in a family practice clinic, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A. Place the stethoscope over the abdomen. Option B. Count respirations before locating the pulse. Option C. Place 2 or 3 fingers over the radial artery at the wrist. Option D. Use the thumb to feel the pulse. The correct answer is option C. Place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. The abdomen is not used for a routine radial pulse. Respirations are measured separately and do not identify the pulse site. The thumb has its own pulse and can interfere with accurate counting. Question 30. The care team in a treatment room asks for guidance because a complete blood count is ordered. Which tube is most commonly used? Option A. Lavender tube with EDTA. Option B. Gray tube with fluoride oxalate. Option C. Light blue tube with sodium citrate. Option D. Red tube with no anticoagulant. The correct answer is option A. Lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Gray tubes are used for tests such as glucose or lactate depending on protocol. Sodium citrate is used mainly for coagulation studies. A red tube allows clotting and is not the standard choice for a complete blood count. Question 31. Following office protocol in a patient intake station, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Abandonment. Option B. Patient autonomy. Option C. Respondeat superior. Option D. Beneficence. The correct answer is option B. Patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Respondeat superior concerns employer responsibility for employee actions. Beneficence means acting for the patient's good but does not override a competent refusal. Question 32. In a preventive care visit, a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A. Ignore the anxiety to avoid making it worse. Option B. Promise that the provider will not be concerned. Option C. Tell the patient the reading is probably wrong. Option D. Acknowledge the concern and explain the procedure in simple terms. The correct answer is option D. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Ignoring patient concerns can increase anxiety and weaken communication. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Question 33. While working in a cardiology practice, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A, discuss the patient's body in the hallway. Option B, skip explanations because the patient signed in. Option C, leave the patient uncovered until the provider arrives. Option D, provide appropriate draping and expose only the area being examined. The correct answer is option D, provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Public discussion can violate privacy and professionalism. Patients still need respectful communication during preparation. Unnecessary exposure reduces dignity and comfort. Question 34. At the start of care in a quality control review, a patient is placed lying face down for a back examination. Which position is being used? Option A, Fowler. Option B, prone. Option C, supine. Option D, lithotomy. The correct answer is option B, prone. Prone means lying on the abdomen with the face downward. Fowler is a seated or semi-seated position. Supine means lying on the back. Lithotomy involves legs in stirrups for certain pelvic procedures. Question 35. After reviewing the situation in a pediatric clinic, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A, interpret the abbreviation however it seems most likely. Option B, ignore the medication order completely without communication. Option C, clarify the order before proceeding. Option D, ask another patient what the abbreviation means. The correct answer is option C, clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. Guessing can lead to serious medication errors. The order should be clarified rather than silently ignored. Patients are not appropriate sources for interpreting orders. Question 36. At the start of care in a primary care office, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A, a promise that medication will be prescribed. Option B, caller identity, contact information, reason for call, and urgency. Option C, only the caller's first name. Option D, the assistant's guess about the diagnosis. The correct answer is option B, caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. Medication decisions belong to the provider. A first name alone may not identify the patient or issue. Diagnosis should not be guessed in a phone message. Question 37. After reviewing the situation in an administrative check-in area, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A, change only the paper on the exam table. Option B, spray disinfectant and wipe it off immediately every time. Option C, open the door to air out the room only. Option D, clean and disinfect touched surfaces according to office protocol. The correct answer is option D, clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. The exam table paper does not address other touched surfaces. Disinfectants usually require the manufacturer's contact time to work properly. Ventilation alone does not remove organisms from contaminated surfaces. Question 38. Following office protocol in a treatment room, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A, the oral temperature will decrease. Option B, the patient will automatically faint. Option C, the reading may be inaccurate. Option D, the pulse oximeter will stop working. The correct answer is option C, the reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Cuff placement does not change oral temperature. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Blood pressure cuff alignment does not control the pulse oximeter. Question 39. During a diagnostic testing area, the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A, the machine cannot record any heartbeat unless the patient holds breath for 5 minutes. Option B, electrodes are used only to deliver medication. Option C, movement changes the patient's blood type. Option D, a movement can create artifact that makes the tracing harder to interpret. The correct answer is option D, movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Normal breathing is usually allowed, but excessive movement should be avoided. Electrodes detect electrical activity and do not deliver medication during a standard recording. Movement has no effect on blood type. Question 40. In an internal medicine office, an intradermal test is being prepared. Which description matches the route? Option A, injection just under the epidermis to form a small wheal. Option B, injection into deep muscle tissue. Option C, medication placed into the ear canal. Option D, medication swallowed by mouth. The correct answer is option A, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Deep muscle injection is intramuscular. Ear canal administration is otic. Swallowed medication is oral administration. Question 41. An office review in an infection control audit shows that a peak flow test is ordered. Which body system is being assessed? Option A, integumentary system. Option B, skeletal system only. Option C, urinary system. Option D, respiratory system. The correct answer is option D, respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The integumentary system involves the skin, hair, and nails. Peak flow does not measure bone structure. The urinary system is assessed with urine tests and related procedures. Question 42. Before the visit continues in a quality control review, a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A, label the tube after returning to the lab. Option B, use the room number because it is faster. Option C, ask the patient to state 2 identifiers and compare them with the order. Option D, ask a family member to confirm the name only. The correct answer is option C, ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A room number can change and is not considered a reliable patient identifier. A family member may be mistaken and 1 identifier is not enough for positive identification. Question 43. As part of exam preparation in a walk-in clinic, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, PERLA. Option B, HIPAA. Option C, RICE. Option D, PASS. The correct answer is option D, PASS. PASS stands for pull, aim, squeeze, and sweep. PERLA describes pupil assessment. HIPAA governs health information privacy and security. RICE refers to rest, ice, compression, and elevation for certain injuries. Question 44. As part of exam preparation in a cardiology practice, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A, record the respiratory rate from the last visit. Option B, count respirations while the patient is unaware of the measurement. Option C, count for 5 seconds and multiply by 12. Option D, ask the patient to breathe as deeply as possible. The correct answer is option B, count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Current respirations must be measured during the encounter. Very short counts are often inaccurate for respirations. Deep breathing changes the normal respiratory rate and effort. Question 45. After reviewing the situation in a same-day appointment, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A, use gloves and dispose of the dressing according to biohazard policy. Option B, handle the dressing with bare hands. Option C, save the dressing in the patient's purse. Option D, place the dressing on the clean supply tray. The correct answer is option A, use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Bare hand contact increases exposure risk. Biohazard waste should not be sent home in personal belongings. Soiled material can contaminate clean supplies. Question 46. When a patient encounter unfolds in a family practice clinic, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A, write a new date on the package. Option B, use the instruments if the package is dry. Option C, reprocess the instruments before use. Option D, open the package and rinse the instruments. The correct answer is option C, reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. Changing the date without reprocessing is unsafe and misleading. A dry package alone does not override an expiration policy. Rinsing does not restore sterility. Question 47. To protect safety in a women's health clinic, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A, tell the patient to bring personal gloves only. Option B, ignore the allergy if the procedure is short. Option C, use powdered latex gloves because they are easier to put on. Option D, use latex-free supplies and clearly communicate the allergy. The correct answer is option D. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. The clinic remains responsible for preparing a safe care environment. Even brief latex exposure can cause a serious reaction. Latex gloves can trigger a reaction in a latex allergic patient. Question 48. Before the visit continues in a telephone triage workflow, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A, remove the band so it does not worry the patient. Option B, ignore the band if the patient seems healthy. Option C, verify the allergy information in the record and with the patient. Option D, give medication first and ask about allergies later. The correct answer is option C, verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Removing an alert without direction can create risk. Allergy risk is not based on appearance. Allergies must be checked before administration. Question 49. A medical assistant is working in a specialty referral visit when a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A, tell the patient dizziness is impossible. Option B, ask the patient to walk faster. Option C, leave the patient standing while searching for forms. Option D, assist the patient to sit or lie down safely. The correct answer is option D, assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Dismissing symptoms does not protect patient safety. Walking can increase fall risk when the patient is dizzy. An unsteady patient should not be left unsupported. Question 50. After reviewing the situation in a specialty referral visit, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, offer water by mouth immediately. Option B, finish documenting the previous visit. Option C, move the patient to a chair before assessing. Option D, activate emergency response and assess breathing according to training. The correct answer is option D, activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Giving oral fluids to an unresponsive patient risks aspiration. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Question 51. Given the workflow in a family practice clinic, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A, include unrelated patient charts in the same fax. Option B, leave the fax confirmation on a public counter. Option C, send it to a number from memory without checking. Option D, verify the recipient fax number before sending. The correct answer is option D, verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Only necessary information should be disclosed. Confirmation pages may contain protected information and should be handled securely. Memory errors can lead to misdirected protected information. Question 52. In a cardiology practice, a used needle must be discarded after an injection. Which practice is safest? Option A, carry the needle to the front desk for disposal. Option B, recap the needle with both hands. Option C, place the needle in regular trash. Option D, activate the safety device and place the needle in a sharps container. The correct answer is option D, activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Transporting exposed sharps through the office increases risk. Two-handed recapping increases needle stick risk. Sharps can injure staff and must not go into regular trash. Question 53. At the start of care in a preventive care visit, blood spills on an exam room floor. Which response follows standard safety practice? Option A. Ask a patient to avoid stepping on it. Option B. Wipe the spill with a dry paper towel only. Option C. Use appropriate personal protective equipment and an approved disinfectant. Option D. Cover the spill with an exam table paper. The correct answer is option C. Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Patients should not be involved in hazardous cleanup. Dry wiping can spread contamination and does not disinfect the surface. Covering a spill does not remove or disinfect the hazard. Question 54. An office review in a pediatric clinic shows that the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A. Oxygen saturation and pain score. Option B. Blood pressure and temperature. Option C. Height and weight. Option D. Pulse and respirations. The correct answer is option C. Height and weight. Body mass index is calculated from height and weight. Oxygen saturation and pain score provide different clinical information. Blood pressure and temperature do not determine body mass index. Pulse and respirations are vital signs but are not used to calculate body mass index. Question 55. A medical assistant is working in a treatment room when a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A. Hold the medication and notify the provider. Option B. Administer the medication because it was ordered. Option C. Change the medication to another drug independently. Option D. Ask the patient to sign a form and give it anyway. The correct answer is option A. Hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. Medical assistants do not independently substitute medications. A form does not make an unsafe medication appropriate. Question 56. At the start of care in a certification exam scenario, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Wash the area and report the exposure according to protocol. Option B. Hide the incident if there is no bleeding. Option C. Finish all remaining patients before telling anyone. Option D. Place a bandage on the site and ignore it. The correct answer is option A. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Delaying reporting can delay needed evaluation and follow-up. Covering the wound alone does not address exposure risk. Question 57. Before the visit continues in an outpatient laboratory, a patient needs crutch walking education after provider instruction. Which principle is important? Option A. Crutches should be used only on wet floors. Option B. Body weight should rest mainly on the armpits. Option C. Crutches should fit properly and not press into the axilla. Option D. The patient should skip follow-up if pain increases. The correct answer is option C. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Crutches are mobility aids and wet floors increase fall risk. Weight should be supported through the hands, not the axilla. Worsening symptoms should be reported according to instructions. Question 58. When a patient encounter unfolds in an infection control audit, a patient asks for a copy of their medical record. Which action should the assistant take? Option A. Refuse because records belong only to the provider. Option B. Delete sensitive information before the request is reviewed. Option C. Follow the office release of information process. Option D. Give the record to anyone who asks. The correct answer is option C. Follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Patients have rights to access their health information under applicable rules. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Question 59. For a patient encounter in a primary care office, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A, quality control testing. Option B, routine scheduling. Option C, appropriate marketing. Option D, breach of confidentiality. The correct answer is option D, breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Quality control relates to test system accuracy, not social media disclosure. Scheduling does not involve posting private health information publicly. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Question 60. While working in a phlebotomy station, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A, count for 10 seconds and multiply by 6. Option B, count the pulse for a full 60 seconds. Option C, skip the pulse and record not available. Option D, use the patient's previous pulse from the chart. The correct answer is option B, count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. Short counts are less reliable when the rhythm is irregular. The findings should be measured and reported rather than skipped. Old values do not represent the current clinical status. Question 61. While working in a procedure setup, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A, maintain required temperature storage and check expiration before use. Option B, use it after expiration if it looks clear. Option C, store it in a desk drawer overnight. Option D, place it in direct sunlight to warm quickly. The correct answer is option A, maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Appearance does not prove potency after expiration. Room temperature storage can damage refrigerated products. Sunlight and heat can damage the product. Question 62. At the start of care in a specialty referral visit, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A, first drops of urine into an unclean container. Option B, clean catch midstream specimen. Option C, a random sample from an old urinal. Option D, specimen collected from the toilet bowl. The correct answer is option B, clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Initial urine can carry contaminants and an unclean container is inappropriate. Old specimens may be contaminated and may not reflect current results. Toilet water contaminates the specimen. Question 63. An office review in an administrative check-in area shows that a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A, droplet precautions only. Option B, airborne precautions. Option C, reverse isolation for staff protection only. Option D, contact precautions only. The correct answer is option B, airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Droplet precautions do not address smaller airborne particles that can remain suspended. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Question 64. At the start of care in a diagnostic testing area, the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A, give the tracing to the provider promptly according to protocol. Option B, diagnose the rhythm for the patient. Option C, change the tracing to make it look normal. Option D, discard the tracing to avoid alarming the patient. The correct answer is option A, give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Medical assistants should not provide a cardiac diagnosis. Altering medical records is unethical and unsafe. Abnormal results must not be hidden or discarded. Question 65. Given the workflow in a patient intake station, a prothrombin time test is ordered. Which tube should be selected? Option A, light blue tube. Option B, gray tube. Option C, blood culture bottle only. Option D, lavender tube. The correct answer is option A, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Gray fluoride oxalate is not the standard additive for coagulation studies. Blood cultures detect microorganisms and are not used for prothrombin time testing. Lavender EDTA is used for hematology and can interfere with coagulation testing. Question 66. An office review in a busy front office shows that a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A, move all chest leads to the abdomen. Option B, apply electrodes directly over lotion. Option C, use tape only and skip electrodes. Option D, clean and dry the skin before applying electrodes. The correct answer is option D, clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Incorrect lead placement changes the tracing and may impair interpretation. Poor adhesion can cause artifact or lead loss. Tape cannot record cardiac electrical activity. Question 67. For a patient encounter in an outpatient laboratory, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A, begin CPR and use the automated external defibrillator as directed. Option B, wait for the provider before starting any response. Option C, use the defibrillator on a conscious patient asking questions. Option D, give oral medication before checking responsiveness. The correct answer is option A, begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Delaying basic life support can reduce survival. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Oral medication is unsafe when cardiac arrest is suspected. Question 68. For a patient encounter in a quality control review, a specimen must be protected from light after collection. Which handling method is appropriate? Option A, place the tube in direct sunlight to warm it. Option B, wrap the specimen in foil or use an amber container as directed. Option C, leave the specimen uncovered at the front desk. Option D, shake the specimen vigorously for 1 minute. The correct answer is option B, wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Sunlight can degrade light-sensitive specimens. Delayed or improper handling can compromise results. Vigorous shaking can hemolyze blood specimens. Question 69. While working in a busy front office, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A, gloves completely replace hand hygiene. Option B, alcohol sanitizer is always illegal in clinics. Option C, hand washing is needed only before eating. Option D, soap and water help remove spores more effectively from the hands. The correct answer is option D, soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Gloves reduce exposure but do not replace hand hygiene after removal. Alcohol-based hand rubs are appropriate for many routine situations. Hand hygiene is required at multiple points in patient care. Question 70. Before the visit continues in an administrative check-in area, a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A, 5 milliliters. Option B, 1 milliliter. Option C, 10 milliliters. Option D, 0.5 milliliter. The correct answer is option D, 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 5 milliliters would provide 500 milligrams at this concentration. 1 milliliter would provide 100 milligrams. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. Question 71. Before the visit continues in an electronic health record review, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A, leave the wheelchair unlocked for easier movement. Option B, ask the patient to jump to the table. Option C, pull the patient by the arms quickly. Option D, lock the wheelchair and use proper body mechanics with assistance as needed. The correct answer is option D. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. An unlocked wheelchair can roll and cause a fall. Jumping is unsafe and unrealistic for a transfer. Pulling can injure the patient and the assistant. Question 72. During a treatment room, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A. Avoid documenting that instructions were given. Option B. Create new instructions that contradict the provider. Option C. Review the provider-approved instructions and confirm understanding. Option D. Tell the patient not to call if symptoms worsen. The correct answer is option C. Review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Patient education should be documented according to policy. Instructions should match the provider's plan and office protocol. Patients should know when and how to seek help for concerning symptoms. Question 73. For a patient encounter in a pediatric clinic, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option B. Ignore all provider instructions about inhalers. Option C. Wear tight clothing that restricts breathing. Option D. Eat a heavy meal immediately before every test. The correct answer is option A. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. Medication instructions should follow the provider or testing protocol. Restrictive clothing can interfere with respiratory effort. A heavy meal may interfere with comfortable breathing for some tests. Question 74. An office review in a community health clinic shows that the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Correct the date of birth without asking anyone. Option B. Stop and resolve the discrepancy before proceeding with care. Option C. Use the appointment time as the identifier. Option D. Continue if the last name matches. The correct answer is option B. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Changing demographic data without verification may create a documentation error. Appointment times are scheduling data and are not approved identifiers. A last name alone does not rule out an identity error. Question 75. When a patient encounter unfolds in an urgent care office, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A. Subcut. Option B. 4. Option C. PA. Option D. IM. The correct answer is option C. PA. PA means by mouth and is used for oral administration. Subcut means subcutaneous and refers to injection into tissue under the skin. 4 means intravenous and refers to administration into a vein. IM means intramuscular and refers to injection into muscle. Question 76. Given the workflow in a specialty referral visit, the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A. Inflammation. Option B. Surgical removal. Option C. Abnormal softening. Option D. Visual examination. The correct answer is option B. Surgical removal. Ectomy means surgical removal of a structure. Inflammation is indicated by itis. Abnormal softening is indicated by malacia. Visual examination is often indicated by scopy. Question 77. While working in a patient intake station, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A. Ophthalmoscope. Option B. Otoscope. Option C. Reflex hammer. Option D. Centrifuge. The correct answer is option A. Ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. An otoscope is used for the ear canal and tympanic membrane. A reflex hammer tests reflexes and does not visualize the retina. A centrifuge separates specimen components and is not an eye exam tool. Question 78. Given the workflow in a patient intake station, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A. Take the temperature immediately because oral readings are unaffected. Option B. Record the temperature as normal without measuring it. Option C. Switch to a rectal temperature without asking. Option D. Await according to office protocol before measuring the oral temperature. The correct answer is option D. Wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Recent liquids can affect oral temperature results. Vital signs must be measured rather than assumed. Changing to an invasive route requires proper indication and protocol. Question 79. When a patient encounter unfolds in a community health clinic, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A. Use another person's readings if the cuff is shared. Option B. Write only the highest number ever measured. Option C. Skip technique instructions because home cuffs are automatic. Option D. Record readings with date, time, and relevant notes as directed. The correct answer is option D. Record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Readings must belong to the patient. Selective recording can mislead clinical decisions. Proper positioning and technique still matter with automatic cuffs. Question 80. Before the visit continues in a walk-in clinic, a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A. Notify the provider and activate emergency protocol immediately. Option B. Schedule a routine follow-up for next week. Option C. Tell the patient to drive home and rest. Option D. Ignore the symptoms if the injection site looks clean. The correct answer is option A. Notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Potential anaphylaxis cannot be delayed for routine follow-up. Respiratory symptoms and swelling require immediate attention. Systemic allergic symptoms matter even if the injection site appears normal. Question 81. In a family practice clinic, a student asks which blood component helps with clotting. Which answer is correct? Option A. Alveoli. Option B. Plasma glucose. Option C. Neurons. Option D. Platelets. The correct answer is option D. Platelets. Platelets help form clots and support hemostasis. Alveoli are lung structures involved in gas exchange. Glucose is a blood sugar and does not form clots. Neurons transmit nerve signals and are not blood clotting cells. Question 82. A medical assistant is working in a medication administration visit when a pelvic examination is scheduled. Which patient position is commonly used? Option A. Trendelenburg. Option B. Prone. Option C. Lithotomy. Option D. Sims. The correct answer is option C. Lithotomy. The lithotomy position is commonly used for pelvic examinations. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Prone means lying face down and is not the common pelvic exam position. Sims position is often used for rectal procedures or enemas. Question 83. In a patient intake station, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. The assistant diagnoses pneumonia. Option B. Patient is definitely exaggerating the cough. Option C. Patient states, I have had a cough for 3 days. Option D. No documentation is needed for symptoms. The correct answer is option C. Patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Diagnosis belongs to the provider. Judgmental wording is inappropriate and not objective. Symptoms are relevant to the visit and should be documented according to policy. Question 84. During a family practice clinic, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Reaching across the sterile field with an unsterile sleeve. Option B. Keeping sterile items above waist level. Option C. Using sterile forceps for sterile supplies. Option D. Opening the wrapper away from the body first. The correct answer is option A. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile items are generally kept in view and above waist level. Sterile forceps can help maintain asepsis when used correctly. Opening the FAR flap first is a common way to avoid reaching over the field. Question 85. As part of exam preparation in a busy front office, a reagent bottle is past its expiration date. Which action is appropriate? Option A, use it only for abnormal patients. Option B, change the expiration date on the label. Option C, mix it with a new reagent to strengthen it. Option D, do not use it for patient testing. The correct answer is option D. Do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Expired reagents are not reliable for any patient testing. Altering dates is unsafe and unethical. Mixing reagents without approval can invalidate testing. Question 86. To protect safety in an urgent care office, a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A, tighten it further until the vein bulges. Option B, release it and allow the arm to recover before continuing. Option C, move it over the venipuncture site. Option D, ignore the time because tourniquets do not affect tests. The correct answer is option B. Release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. More pressure can increase discomfort and alter specimen quality. A tourniquet is placed above the site, not over the puncture area. Tourniquet time can affect certain laboratory values. Question 87. At the start of care in a medication administration visit, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, a properly grounded machine with still patient. Option B, poor electrode contact or patient movement. Option C, correct limb lead placement. Option D, a normal calibration mark only. The correct answer is option B, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Good grounding and stillness reduce electrical or motion artifact. Correct placement should reduce rather than create artifact. Calibration marks do not explain baseline movement during tracing. Question 88. Following office protocol in a patient intake station, the term cardiology appears in a referral. Which specialty is involved? Option A, skin disorders. Option B, digestive disorders. Option C, kidney disorders. Option D, heart and cardiovascular system. The correct answer is option D, heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Dermatology focuses on the skin. Gastroenterology focuses on the digestive system. Nephrology focuses on the kidneys. Question 89. When a patient encounter unfolds in a primary care office, the term gastroenterology appears in a referral. Which specialty is involved? Option A, endocrine glands. Option B, urinary bladder only. Option C, nervous system. Option D, digestive system. The correct answer is option D, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Endocrinology focuses on hormone-producing glands. Urology focuses on the urinary tract and male reproductive system. Neurology focuses on the nervous system. Question 90. As part of exam preparation in a preventive care visit, a provider orders spirometry in the office. Which patient action is required? Option A, remove the mouthpiece before starting. Option B, follow instructions for a strong, complete breathing maneuver. Option C, talk continuously during the maneuver. Option D, hold both nostrils and refuse to exhale. The correct answer is option B, follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. The mouthpiece is needed to measure airflow. Talking interferes with airflow measurement. The test depends on controlled breathing through the device. Question 91. At the start of care in a patient education session, a patient has an advance directive in the chart. Which statement is most accurate? Option A, it allows the assistant to ignore provider orders. Option B, it replaces all insurance forms. Option C, it communicates the patient's wishes about future medical care. Option D, it is used only to schedule appointments. The correct answer is option C, It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Care decisions still follow legal, clinical, and facility processes. Advance directives do not replace billing or insurance documents. Scheduling is unrelated to the purpose of an advance directive. Question 92. A medical assistant is working in a pediatric clinic when a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A, gray tube. Option B, blood culture bottle. Option C, light blue tube. Option D, lavender tube. The correct answer is option A, gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Blood culture bottles are used to detect bloodstream microorganisms. Light blue citrate is used for coagulation studies. Lavender EDTA is used mainly for hematology testing. Question 93. Following office protocol in an urgent care office, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, skip the explanation if the patient nods. Option B, use a qualified medical interpreter. Option C, speak louder and slower in English only. Option D, ask a young child to interpret. The correct answer is option B, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Nodding does not prove understanding or valid communication. Volume does not remove a language barrier. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Question 94. While working in an exam room, a sterile package is torn before a minor procedure. Which action is required? Option A, consider the contents contaminated and obtain a new sterile package. Option B, use the items if they look clean. Option C, spray the package with disinfectant. Option D, tape the wrapper and use the contents. The correct answer is option A, consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Clean appearance does not prove sterility. Surface disinfectant cannot sterilize items inside a compromised package. Taping does not restore sterility after the barrier is compromised. Question 95. To protect safety in a specialty referral visit, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, Sims. Option B, prone. Option C, Fowler. Option D, supine. The correct answer is option D, supine. Supine means lying on the back facing upward. Sims position is side lying with one knee flexed. Prone means lying face down. Fowler position is seated or semi-seated. Question 96. Given the workflow in a procedure setup, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A, lung gas exchange. Option B, ventricular depolarization. Option C, atrial repolarization only as the visible main event. Option D, ventricular filling with blood only. The correct answer is option B, ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Gas exchange occurs in the alveoli, not on the QRS waveform. Atrial repolarization is usually hidden within the QRS complex. Mechanical filling is not the primary electrical event represented by QRS. Question 97. After reviewing the situation in a medication administration visit, the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A, pulmonary artery. Option B, pulmonary vein. Option C, aorta. Option D, superior vena cava. The correct answer is option A, pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. Pulmonary veins return oxygenated blood from the lungs to the left atrium. The aorta carries oxygenated blood from the left ventricle to the body. The superior vena cava returns venous blood to the right atrium. Question 98. During a quality control review, a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A, tell the patient fasting means no restrictions at all. Option B, tell the patient to stop all diabetes medications without provider input. Option C, cancel the test because diabetes always prevents fasting labs. Option D. Review fasting instructions and route medication questions to the provider. The correct answer is option D. Review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Fasting usually includes specific limits on food and drink. Medication changes can be unsafe without provider direction. Diabetes requires careful instructions but does not automatically cancel testing. Question 99. An office review in an outpatient laboratory shows that lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. 5th intercostal space at the left midclavicular line. Option B. 4th intercostal space at the left sternal border. Option C. 4th intercostal space at the right sternal border. Option D. Midway between V2 and V4. The correct answer is option A. 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space along the left midclavicular line. That location is used for V2. That location is used for V1. That location is used for V3 rather than V4. Question 100. Before the visit continues in a medication administration visit, a patient signs permission after the provider explains a procedure's risks, benefits, and alternatives. Which concept is demonstrated? Option A. Informed consent. Option B. Implied consent. Option C. Battery. Option D. Abandonment. The correct answer is option A. Informed consent. Informed consent occurs when a patient agrees after receiving enough information to make a voluntary decision. Implied consent is inferred from actions such as extending an arm for a blood draw. Battery involves unauthorized touching or treatment. Abandonment involves ending care without appropriate notice.